Hi everyone, welcome back to another video. In today's video we are going to discuss about high blood pressure in pregnancy. Some people may not have high blood pressure before. There's some people who do not have blood pressure when they are not pregnant, but immediately they get pregnant, the blood pressure starts to rise. So we are going to look at what is this high blood pressure, what we call preeclampsia. We are going to look about preeclampsia, that is preeclampsia in pregnancy, and then we are going to look at those people who are at risk of getting preeclampsia, and also we are going to look at signs and symptoms. How can you know that you have preeclampsia? You know, some people may go to the hospital when it is too late, the condition has already complicated to eclampsia, and we are going to look at these signs so that when you realize you are experiencing these signs and symptoms, then you're supposed to go for checkup, or you're supposed to go to the hospital. And also we are going to look at complications that may come in when you have preeclampsia. Yeah, those are the things that we are going to look today. So if you have not subscribed, kindly do so. You can like the video, share, comment. Don't forget also to turn your notification bell, because every time we post a video, you will be the first person to be notified. So let us look at what is preeclampsia, formerly called toxemia. Is when pregnant women have high blood pressure, protein in urine, and swelling in their feet, legs, and hands. It can range from mild to severe. It usually happens late in pregnancy, though it sometimes can start earlier. So it is high blood pressure in pregnancy. Preeclampsia is high blood pressure in pregnancy, and the person will present with swelling in the feet, hands, legs. There will be also protein in urine, and it can range from severe, mild to severe. Yes, that is what is preeclampsia. What we know as what some people will tell you, that I have high blood pressure when I was pregnant. That is how we call it preeclampsia. So because some people do not know the signs and symptoms, preeclampsia can lead to eclampsia. That is a serious condition that can put a woman at risk for for herself and also for the baby. Although it is a rare case, but if preeclampsia is not managed, then you can even die. If your preeclampsia lead to eclampsia, you will present with seizures. The only cure for preeclampsia is to give birth. When you start presenting with all the other signs and symptoms that I'm going to say, even after delivery, these symptoms may still continue or may still persist up to 6 weeks. That is postpartum period, and you can help protect yourself by learning the symptoms of preeclampsia and by seeing your doctor for regular prenatal care. And I want to say that prenatal care is very important, because you might get that when we are going to look at the risk factors, you will get that somebody who is having high blood pressure is at risk of developing preeclampsia when she is pregnant. But if you go for preconception care, then these conditions that can lead to preeclampsia, like high blood pressure or hypertension, can be managed before you get pregnant. So that is why I'm saying preconception care is always very important for anybody who wants to get pregnant. Yeah. So let's look at signs and symptoms of preeclampsia, because you know that most people usually come to the hospital. African people usually go to the hospital after the condition has reached to its latest stage. When someone is presenting with complication is when this person sometimes most people usually come to the hospital. But if you know these signs and symptoms that a person can present with, when your sister, when your wife, when you are somebody you are close to is presenting with these signs, you can advise that person to go to the hospital before the person complicates to other conditions when this person is having preeclampsia. So what are these signs and symptoms? The first sign, this is what you will not know until you come to the hospital. There will be high blood pressure. High blood pressure that is over 140, 140 over 90 and above. That is the first sign that a person who is having preeclampsia will present with. But until you go to the hospital is when you will know your blood pressure. Another one is protein in urine. This one you can't also know it when you are at home, but when you go to the hospital and we do urinalysis is when we can get to know that you are having preeclampsia. When you get protein in urine, when your urine is having protein, is when we can know that you are having preeclampsia. So high blood pressure and protein in urine, these are signs that maybe a doctor or a nurse or a healthcare provider is the one who can analyze and tell you if you are a person who is having preeclampsia or not. Okay. The other sign that you will alarm or will raise an eyebrows is weight gain, or over 1 to 2 days because of a large increase in bodily fluid. That is, you get that when you are having a preeclampsia, you are your face, your hands, your feet, the whole body you can get edema, the whole body. So your body can just swell from just nowhere. And you, if you experience this and you are pregnant, you are supposed to go and see your doctor or the nurse who is always attending to you. The next one is belly pain. Belly pain sometimes is normal. We can call them Brandt's contraction when you are pregnant. But now if it is especially in the right upper side of your abdomen, if it is in the right upper side, then you should suspect and you should go and see the doctor. Another one that will also raise an eyebrows for a pregnant woman is severe headache. If you are experiencing severe headache and you are pregnant, you're supposed to go and see the doctor, or you are supposed to go to the hospital. The next one is a change in the reflexes or mental status. You can have problem with the so I was saying before I got distracted, changes in reflexes and mental status is also a sign, and this one is only someone who is having medical knowledge, that the people who can analyze if you are having a change in reflexes and mental status. Also, if you are having oliguria, or you don't have urine at all, you can have less urine, or you may fail to have urine at all. Some even if you're pregnant, you're supposed to getting frequent urination. Even if it is not frequent, then you're supposed to be at least getting urine within 24 hours. And if it is not there, or if it is just little that you're even forcing yourself to go and urinate, then you're supposed to go to the hospital. You might be having a preeclampsia. And another thing again is dizziness. If you're experiencing dizziness and you're pregnant, that is also a sign that you might be having preeclampsia and you don't know. Another thing is also difficulty in breathing. This one also, someone is having preeclampsia will present with, and if you're experiencing that, then you're supposed to go and see your doctor. Another one is nausea and vomiting. It's always normal for a pregnant person or a pregnant woman to vomit and to have nausea sometimes. But if it is severe and you're vomiting most of the time, then you're supposed to go to the hospital. You might be having hyperemesis gravidarum, or you might be having preeclampsia. So you're supposed to go and see the doctor if you are just vomiting a lot. Another thing is also if you are having difficulty with your eyes, with seeing, vision changes, like you're having flashing light, blurry vision, then you are supposed to go and see your doctor. Those are some of the signs and symptoms that someone who is having preeclampsia can present with, and anybody can diagnose or can suspect that something is not right, and then you are supposed to take the person to the hospital. If you're the one, you're not supposed to stay at home. You're supposed to go and see a specialist, or you're supposed to go to the hospital. You get diagnosed before it is too late, before the complication complicates to other conditions. So another question I know that you are asking yourself, or you will ask me in the comment section, and I don't want you to ask me, it is here. I'm answering it. When do these symptoms show up? Preeclampsia can happen as early as 20 weeks. I said when I was starting the video that the condition usually happen start at late pregnancy, but it can also start at as early as 20 weeks into pregnancy, but that is rare. Symptoms often begin after 34 weeks most of the time. In few cases, symptoms develop after birth, usually within 48 hours of delivery, and they tend to go away by their own. If you happen to have these symptoms after delivery, most of the time they usually go away on their own. Yeah. So the next question, what are the causes of preeclampsia? Many experts think preeclampsia and eclampsia. Eclampsia is the complication of preeclampsia. That is when now a patient is presenting with seizures, all other signs plus seizures. So many experts think eclampsias and preeclampsia happen when a woman's placenta does not work the way it should, but they don't know exactly why it's usually occur. Some think poor nutrition may lead to preeclampsia, or other also think that having a high, those who are obese can also get preeclampsia, but there is no known cause of preeclampsia. Another factors that has been a contributing factor is also genes. Maybe if you are having a family history of preeclampsia, you are at risk of getting preeclampsia. So there is no known information why preeclampsia may. Sometimes you don't have high blood pressure and it will all occur in a pregnant woman. So there is no known information about it, but those are some of the things that scientists has thought that might lead to preeclampsia. So let us look at some of the risk factors. Now, the risk factors that can lead to preeclampsia. Some of the risk factors that can lead to preeclampsia: number one, being a teen or being a woman over 40 years. We usually say that women of reproductive age is within 15 to 45 years, and also and again, if you get pregnant past 40, you are at risk of getting preeclampsia. And another thing that is also can put one at risk of getting preeclampsia is when you are still 17, 18 and below, and you get pregnant. That one can put you at risk of getting preeclampsia. Another, number two, is being an African woman. Being black, being an African woman, we don't know the reason behind it, but they say that being an African and a woman can put you at risk of getting preeclampsia. Another point, being pregnant for the first time. If you get pregnant for the first time, sometimes you are at risk of getting preeclampsia. There are no known reason behind all these points, but those are the risk factors that have been put in place. Another thing is having babies less than 2 years apart or more than 10 years after 10 years. So if you have, they're saying, if you are having babies, you should have babies after 2 years. You should get pregnant after every 2 years. Then also, if you wait too long, past 10 years, then you are also at risk of getting preeclampsia. So don't wait too long, and also don't get pregnant too early. 2 years, 10 years. 2 years, before 10 years, before 2 years, you can get preeclampsia. And also after 10 years, you can also get preeclampsia. What am I saying? I don't think, I think I'm making sense. I'm saying having babies less than 2 years can put you at risk of getting preeclampsia. And another point is also saying having baby after 10 years can also put you at risk of getting preeclampsia. The next point, pregnancy with a new partner instead of the father of your previous children. Sorry. Those who like having babies, each child is having a father. You are putting yourself at risk of getting preeclampsia. And you know, if you have preeclampsia, the chances of developing hypertension even after giving birth is high. The chances of getting heart condition is also high. So if you want to give birth, please kindly give birth with one man until you are very much satisfied that these are the children that you want. Don't make it as a routine that each child with the father. Every child is having a father. You are having 8 children with 8 fathers. Surely it is not even right. So apart from even getting preeclampsia, you are putting yourself at risk of getting other conditions, STI, HIVs, among other conditions. So don't make it as a routine that you are having babies who are having every child is having a father. So that is the point. The next point is having high blood pressure before getting pregnant. I was saying before, there is where I said that preconception care is very important. When you go for preconception care and maybe you were having high blood pressure and you didn't know, this condition can be stabilized before you get pregnant. So if you're having high blood pressure before you get pregnant, the high chances of getting preeclampsia when you are pregnant is high, more than that person who did not have high blood pressure before getting pregnant. Another point is a history of preeclampsia. If other pregnancies you had suffer from preeclampsia, then the previous pregnancies are the subsequent pregnancy, you are at risk of suffering preeclampsia. Another thing, another point is also family history. If your mother, your sister had suffered preeclampsia when they were having babies, then you are at high risk of suffering the same condition. The next point is obesity or history of obesity. You can suffer from preeclampsia. And another thing is also carrying more than one baby. Those who are admiring twins and triplets, it can put you at risk of getting preeclampsia. Also in vitro fertilization, those who have getting pregnant through artificial, then you can also get preeclampsia. I know one person who had suffered this condition, who got preeclampsia when he got in vitro fertilization. So this can put you at risk of getting preeclampsia. If you are having history of obesity, kidney disease, this condition can put you at risk of getting preeclampsia. Those are some of the risk factors that can put you at getting preeclampsia or getting high blood pressure when you are pregnant. Now, what are the complications? You know, most conditions, they usually have complications. There must be a complication if these conditions are not treated. So what are the complications that might set in if this condition is not treated? Number one is eclampsia. Eclampsia is a complication of preeclampsia if preeclampsia was not treated or managed well. A person will present with seizures and then the other signs and symptoms that I already listed. The next thing that a person can suffer from is stroke. The person can go into stroke. The person can develop seizures. This person, this person can develop seizures even after delivery. The person might not heal or may not recover from it, and it will. The person might live with seizures or epilepsy throughout. And then also the person might present with chest pain, heart failure can set in, irreversible blindness if preeclampsia was not managed. Liver diseases or bleeding from the liver can also set in, and then also postpartum hemorrhage might also set in. When preeclampsia or eclampsia damage your liver and blood cells, if this preeclampsia damage your liver and blood cells, you can get complication called HELLP syndrome. HELLP syndrome, that is H stands for hemolysis. This is when the red blood cells that carry oxygen through your blood break down, and also E stands for elevated liver enzyme. High level of this chemical in your blood means liver problem. Also, the person can suffer from low platelets count. This is when you don't have enough platelets, so your blood does not clot the way it should be. So HELLP syndrome is a medical emergency. If you are a nurse, if you are a student nurse, if you are anybody who is a health professional, then you should call for help. You should call for help if you have a patient who is having HELLP syndrome, so that it can be managed as what? With with other expert, and the health syndrome should be managed as a collaboration team. The doctors, the surgeon, the pediatrician, yeah, all those medical practitioners should come in board and manage this person. And this person may present with blurry vision, chest or belly pain, headache, fatigue, nausea and vomiting. So another thing that is more dangerous that also preeclampsia can cause is suddenly separate of placenta from the uterus, which is called placenta abruption, and it can lead to stillbirth. Yeah, that is how serious preeclampsia is. So prevention of this preeclampsia: you should stop smoking, you should stop, or you should not have overweight. If you are having high blood pressure, or you are having how do you call it, hypertension, no, not hypertension. If you are having high blood pressure, or you are having heart diseases, or you are having any DM, then this condition should be controlled before you get pregnant. The last thing that I want to say, preeclampsia is manageable, and if you experience this sign, just go to the hospital as early as possible. You will get help. So I think I've reached the end of the video. If you have not subscribed, please kindly do so. And if you are a returning subscriber, or if you're new here, please subscribe, and thank you for watching this video. If you're a returning subscriber, thank you very much for always clicking in and supporting this channel. So bye till next time. Let's meet in the next video. In case you want me to talk about something, you can tell me in the comment section. I will always consider, because even this preeclampsia, I was asked by someone to talk about it. That is why I did this video. I think I've answered someone who was not even, I've answered some questions that were not even, I was not even asked. Yeah. So bye, let's meet in the next video.